You forget a name, you lose your train of thought mid-sentence, and you quietly panic. Is this just stress or something worse already happening inside your brain? Your yearly blood work, complete metabolic panel, lipids, maybe thyroid, it's blind to the kind of damage that starts decades before dementia. It cannot see the silent decay of axons or the accumulation of toxic protein tangles. There are two markers, however, that can: neurofilament light, or NFL, and phosphorylated tau-2,7. They show up in a simple blood sample, and research has shown that their levels begin to rise 10, sometimes 20 years before you notice any cognitive symptoms. That's a clinical time machine hidden in your veins. I remember sitting in my office late at night, scrolling through a stack of recent papers on blood-based neurodegeneration biomarkers, and I had to pause. If this is real, and the data are accumulating, the window for intervention isn't when you start forgetting names. It's already open right now. Now, if you're in your late 30s, 40s, or 50s, and you've caught yourself blanking on a word or walking into a room and forgetting why, you've probably told yourself it's normal aging. And some of it is. But there is a difference between age-related cognitive slowing and the early footprint of Alzheimer's pathology. The difference is undetectable by a standard MRI or a cognitive screening at your doctor's office, but it is measurable in your blood. Here's what NFL and 217 actually tell you. NFL is a structural protein inside the long axons of your neurons. Think of it as the scaffolding of the brain's wiring. When neurons get damaged or degenerate, NFL leaks into the cerebrospinal fluid and eventually into the bloodstream. Elevated blood NFL is a sensitive, though not specific, marker of neuronal injury. It rises in traumatic brain injury, multiple sclerosis, and yes, in the preclinical stages of Alzheimer's disease. Tau-17, on the other hand, is a phosphorylated fragment of the tau protein. Tau normally stabilizes microtubules inside neurons. But in Alzheimer's, tau becomes hyperphosphorylated and clumps into neurofibrillary tangles, one of the hallmark pathologies. The POUN17 form appears to be specific to Alzheimer's type pathology and leaks into the blood very early in the disease process. So you have one marker that screams neurons are being injured, and another that whispers Alzheimer's pathology is building. Together, they give you a picture that your standard blood work and even your brain MRI cannot. Now the practical part, can you get these markers today? Yes, but not easily. Some specialty labs offer them, and certain research centers you may have to push. Your primary care physician might not have heard of them, or might dismiss them as too experimental. And here's the moment where I need to be honest. These are not yet part of routine clinical practice, but they should be on your radar. If you decide to pursue testing, you want to look for a blood draw for NFL and 17, ideally run by a lab that has published reference ranges. The numbers alone aren't a diagnosis, they're a risk signal. So what does a high result mean? It means your brain is showing signs of injury that correlate with a higher probability of cognitive decline over the next decade or two. It does not mean dementia is inevitable, it means you have a window to act, and that's the part most conversations miss. People hear Alzheimer's biomarker and think doom. But elevated NFL and POUN17 in your 40s or 50s are not a sentence, they're a message. They're telling you that what you do next, your sleep quality, your metabolic health, your exercise, your stress load, is going to matter more than it does for someone with low levels. Here is the second complication. Not everyone with high NFL or P7 will develop dementia. The correlation is strong at the group level, but at the individual level, cognitive reserve, genetics like APOA4 status, vascular health, and other factors play a massive role. This test is not a crystal ball, it's a power tool for those who intend to act on the information. I've seen people get these results and freeze, or worse, conclude there's nothing they can do. That is exactly wrong. Let's connect the mechanism to what you can change today. First, sleep. During deep slow-wave sleep, your brain activates the glymphatic system, a kind of dishwasher that clears out metabolic waste, including amyloid beta and tau. One night of poor deep sleep, measurable increase in tau and NFL in spinal fluid. Prioritizing 7 to 8 hours with adequate deep sleep is not just wellness, it's neuroprotection. Second, insulin sensitivity. Insulin resistance in the brain is a known driver of tau hyperphosphorylation. Keeping fasting glucose and insulin low, maybe through time-restricted eating or reducing highly processed carbohydrates, directly lowers the phosphorylation pressure on tau. Third, exercise. Aerobic exercise increases BDNF, brain-derived neurotrophic factor, which helps repair neurons. It also improves blood flow and reduces neuroinflammation, which can lower NFL over time. And fourth, omega-3 index and vitamin D. Low DHA and low vitamin D are associated with faster brain atrophy and higher conversion to dementia. Getting these into optimal ranges is low-hanging fruit. None of this is expensive or exotic. But the problem is, most people don't know they need to do it urgently, because they don't have a signal that their brain is already under attack. That signal is now available in your blood. Now, when you bring this test up to your doctor, you might hear, not standard, it might cause anxiety, or there's nothing we can do anyway. Those are outdated responses. We don't have a drug that reverses Alzheimer's. But we have interventions that can slow its trajectory, preserve cognitive function, and extend healthy brain years. And those interventions work best when started early, when NFL and 217 are just beginning to rise. You can respond calmly. I understand this is not a diagnostic test. I'm using it as a tool to assess my brain health risk and to guide lifestyle decisions that have evidence for slowing neurodegeneration. That changes the conversation from fear to agency. So here's your practical takeaway. If you're over 40 and you want to know whether the slow oxidation of your brain is already underway, consider adding NFL and p-tau 217 to your annual blood work. If your results are low, you have a baseline and peace of mind. If they're elevated, you don't panic, you get precise. You audit your sleep, your metabolic health, your exercise, your inflammation. You repeat the markers in 6 to 12 months to see if your interventions are moving the needle. You are no longer someone who fears the occasional forgotten name. You are someone who measures the silent processes of brain aging and acts. That is the power of a blood test that sees 20 years ahead.